So you're welcome to today's lecture. And in today's lecture, we are going to be talking about some other structures of the heart that we didn't speak about in the first lecture of our video. So today we'll be talking about first the valves of the heart. And before we dive into the valves of the heart, we want to know that there are key importances of these valves. And along the line as nurses, student doctors, in fact, when you become a medical practitioner, you will eventually need to understand the fundamental importance, physiological functions and importance of the valves so that you could be able to make certain diagnoses and equally educate patients whenever they are presented with certain conditions or disease progressions. So now let's dive right in. When we're talking about the valves of the heart has 4 valves, but subdivided into 2. And when we come to the subdivisions, we can clearly call them, the first, we call them the AV valves, or the atrioventricular valves. Ventricular. And the second, we call them the semilunar valves. Semilunar valves. So let us take them one by one. The AV valves. So why is it that they are called AV? Why are they called AV valves? Well, from the name alone, you can decipher why it's called AV valves. Atrioventricular. Atrium, ventricles. So atrioventricular valves are valves you find between the atrium or an atrium and a ventricle. So we can say that the AV valves allow blood to flow through the atrium and the ventricles, be it the right and the left. So the AV valves are further divided into 2. And the first, between the left atrium and the left ventricle, we have what we call the mitral valve. Or another name we can call it is the bicuspid valve. A bicuspid valve. Now, from the name, the bicuspid, meaning it has 2 cusps, two cusps. The name of the valve that is between the left atrium and the left ventricle is called the mitral or bicuspid valve. This is one of the AV valves, or one of the atrioventricular valves. The next one here that is found between the right atrium and the right ventricle is called the tricuspid valve. Tricuspid valve. Now, from the name too, it means it has 3 cusps. Now, if we were to describe what these cusps looks like in diagrammatic format, this is what it looks like. This is what a cusp looks like. But let's say you were to see, as a medical practitioner or a student nurse or student doctor, you were to come across a live heart. This is what a live image looks like. Moving on. So, we've spoken about the atrioventricular valve. Now, what other valves do we have? Now, remember we spoke about the AV valves, and the next, the semilunar, meaning half of a moon. If you've seen half moon before, semilunar, yeah. So that is what they look like. They look like half moons. So the semilunar valves are the valves that are found between the right and left ventricle and the pulmonary artery and the aorta leaving the heart. So in that case, the name of the valve between the right ventricle and the pulmonary artery is called the pulmonic valve. Pulmonic. pulmonic valve. While the name of the valve that is located between the left ventricle and the aorta is called the aortic valve. So do not confuse this in exam or your examination. If they were to ask you mention the names of the valves in the heart, please do well to mention the pulmonic valve, the aortic valve, the mitral valve, and the tricuspid valve, to avoid stories that would, be unexplainable. So these are the four valves that are available. Now, what else is there to know? Now, what about the physiological functions of these valves? You see, valves may seem like it is something easy to understand. Of course, it is. But it is equally important to note that you need to know appropriately how these valves function and what they do. Now, diagrammatically, the valves look like this. They look like this. So, if I were to put my hand here, if I were to physically show you what the valves look like, they are like this. This is how, whenever blood, let's say this part of my body is the atrium and the bottom part is the ventricles. Whenever blood flows in through the atrium, it opens up and it shuts. The atrioventricular valve opens up and it shuts. The moment there is the amount of blood required in the ventricles is already in, it shuts. The valves were designed in such a way they prevent backflow of blood into the left and right atrium. One of the disorders, or will I say observable conditions that you could find whenever there is a backflow of blood into the chambers of the heart, especially the left atrium, since it's connected to the lungs, is what you call pulmonary edema. Pulmonary edema is when there's fluid overload in the lungs as a result of, poor circulation of blood. These valves were created in such a way they prevent regurgitation. Regurgitation is what we call backflow of blood into a chamber. It prevents it. That is the reason for this design. And that is one of the functions of the valves. Now, what else? Something worthy of note is this. Suppose blood were to flow in from the pulmonary from the pulmonary veins into the left atrium. When the left atrium gets filled with blood, that blood is pumped into the left ventricles. Now, by the time the left ventricle has gotten the sufficient amount of blood it needs, or volume of blood it needs, this is what happens. Do you know that the atrium will prevent the ventricles from pumping blood if these ventricles has not gotten more pressure than the aorta? I repeat myself. The aorta will prevent blood from coming into it because the pressure of the aorta is normally high. So if it is a situation whereby the left ventricle has not accumulated more pressure compared to the aorta, blood cannot flow through. So the aortic valve prevents blood from flowing into the aorta when the pressure is high. And that is the reason why in certain heart conditions, some of the patient's organs will not be able to get enough blood because the heart is not gathering so much power, so much pressure to push out blood through the heart. So when we talk about cardiac rhythms, the valves are equally important because if the valves are not opening and closing at the right time, opening, closing, opening, closing, opening, closing, unfortunately, the heart won't be beating in a rhythmic, in a rhythmic pattern. So at least now we've come to understand some functions of the heart. Now we've spoken about the valves. We've spoken about the valves of the heart. There are certain other structures we need to know about. For example, if you look closely at this diagram, we describe this as muscles, the myocardium of the heart, the myocardium muscles of the heart. But what about this? Attached to the valves of the heart, we have certain structures that keep them in place, be it shut or open, depending on whether the heart is in a diastolic situation, that it is relaxed, or when it is in systolic, when it compresses or contracts, sorry, when it contracts. So this structure you are seeing here, we call it papillary muscles. Papillary muscles are muscles attached to the myocardium. They help hold another structure. Allow me to write that. Papillary muscles. Let me use this. This here. Papillary muscles. Papillary muscles. Now, the papillary muscles hold tendons. Now, these tendons are directly attached. The tendons, as we indicate here in blue and black actually, are structures that are directly attached to your valves. So the name of this tendon is tendinous cord. We call it tendinous cord, or what you will see usually, maybe when you want to write your exam or in most textbooks, you see what they call Chordae tendineae. Chordae tendineae. So the papillary muscles, which is attached to the myocardium or the bottom of the ventricles inside the endocardium, will be attached to the tendinous cord, papillary muscle tendinous cords, or the chordae tendineae. And this chordae tendineae will then be attached to our valves. Now, these three structures found in the heart work in unison to aid in the flow, the unilateral, I don't call it unilateral, but let's say the synchronization, the smooth synchronization of blood flow within the heart. So at least now we have this understanding of certain structures in the heart.